Welcome to Humane at Home. We're very excited to have you joining us today. I'm with Michelle, our amazing medical supervisor. We are going to be featuring the Pilar and Chuck Body Center for Shelter Medicine today. And I'm really excited to show you around with Michelle. We're also going to be talking about spay and neuter. It is Spay and Neuter Awareness Month. It is Dental Month. This is a great month to be visiting our wellness center and see all the amazing things that go on in there. I think we do over 40,000 procedures a year in here.
Yes.
So we're going to see some of those procedures today.
Yeah.
We're going to meet a vet. We're going to see some animals who are getting some help. And thanks for having us, Michelle. We're really excited. So Michelle's going to let us in, and we're going to go in there and start checking it out.
All right, friends. Here you can see our entire treatment area here at the hospital. It's a little messy right now. Things are happening today. It's really busy today. Really busy Friday. Here we have our first room, Shelly, the Stewart room. This is a cat recovery room where we keep all of our hospitalized animals. As you can see over there, we have 2 hospitalized cats, and they're nice and covered because they like their quiet time. And then we have some rabbits here that are going to get surgery today, or that already had surgery. Mr. Jax. Hello, Mr. Jax.
So, Michelle, what is shelter medicine? So when we're saying it's a whole set, because I know that our Center for Shelter Medicine is one of the first kind in California.
Absolutely.
Right?
Yeah. So we have a giant hospital here that we can provide care for all the animals, and not just any basic veterinary shelter care. I mean, we do dentals, FHOs, orthopedic surgeries.
What is an FHO?
Surgeries. Orthopedic surgeries, which is not a common thing that anybody does in regular shelters. I mean, regular shelters maybe can do 10 to 15 spay neuters per day. Here we're doing at least 30 to 40. In addition to our dental procedures, our orthopedic procedures, our rabbit and spay neuter surgeries, community spay neuter surgeries, community cat spay neuter surgeries.
So there's a lot going on.
There is a lot going on. And not just that, but we're a teaching hospital. So we have interns, externs, and we teach them everything. So they basically learn how to spay a dog and a cat here. And it's amazing. I mean, we do so much.
So yeah, so I know we have dozens of veterinarians, and then we have interns as well every year, 4 of them who are here learning. So we're kind of like, I like to say we're like the Grey's Anatomy.
Literally like Grey's Anatomy.
Of the veterinary world, right?
Show.
Exactly. Exactly. And what's cool, or what I find interesting about shelter medicine is that they, you kind of have to be able to care for every different kind of animal. You don't have a specialty like maybe at vet hospital. You could get a turtle, a peacock, a pig.
A pigeon?
A pigeon.
Anything.
A cute puppy. Okay, look behind you, Michelle.
Oh, God.
You know why we're here. We're here for the animals.
Hi, little friend.
Say hello.
Who is this?
So this little baby came in, I think, yesterday night with a broken leg.
Aww.
I'm not sure exactly what happened. Do you know, Barber?
Stray dog.
Yeah, just a stray dog with a little broken leg. So we went ahead and splinted it, offered food. She was ravenously eating like she'd never eaten in her life. And then we bandaged it, and now she's just going to remain on cage rest for 2 weeks before she can be up for adoption.
So fortunately, a good Samaritan found her and brought her in, thank goodness. And now she can get the help she can deserve. Do we want to have a chat with Dr. Barber now?
Yeah, now that we're here.
Oh, sorry, I forget that you have the microphone.
What would we like to chat about?
We're going to chat about, because it is National Spay and Neuter Awareness Month. So we want to talk about the importance of spay and neuter and why it is so important, not just for our shelter pets. It is obviously the best way to control the pet population. And if you adopt from us, every single dog, cat, or rabbit is going to be spayed or neutered before they are adopted. So you don't even have to worry about it if you adopt an animal from us. But if you have a pet at home and you're maybe considering spay neuter, why should they do it? Why is it so important, Dr.
Stacy, I think you nailed it by saying overpopulation. As a shelter veterinarian, overpopulation is something that's important to me. Hi. Oh, is that tasty? Okay.
Oh, you're a chew toy, of course.
But there's a few other reasons why spaying and neutering dogs and cats and rabbits is very important. There's medical and behavioral concerns that can be remedied by this, by a simple surgical procedure or sterilization called spaying or neutering. And what we want to do is we want to increase the lifespan of the pet by removing some of their parts that will actually help them have a long, happy life. It actually reduces the incidence of cancer. So obviously the parts that we actually remove are not going to get cancer because they're not there anymore. Also, there's an increased incidence of mammary cancer in females that are unspayed, female dogs specifically. And so that's one thing. There's a few other behaviors as well. It's getting a little bit warmer. I know it rained today in San Diego, but getting a little bit warmer. Spring is on its way. And we're going to see increased incidence of animals roaming. So trying to go out and find friends, boyfriends and girlfriends. Also, for cats, it can, and dogs too, it can decrease some unwanted behaviors like marking and spraying. Also, sometimes some aggression. And I think the important thing, though, is to remember that spaying and neutering can just provide you with a longer lifetime with your
pet. Yeah,
your
exactly.
friend.
So I think there's like an average of 3 to 5 years longer if they're spayed or neutered. So you get that time with your pet, which is amazing. And like you said, those medical benefits, the health benefits, all of those things. He can stay for just a sec because I'm going to ask him about some misconceptions. But yeah, so you talk about less likely to roam because they don't have that need to go out and find a mate. They won't go into heat. Dogs can actually have, no, you're going to stay here with me. Dogs can actually have 2 litters a year, right?
Oh, yeah.
And cats can have up to how many?
Oh, gosh. I would say about the same, but let's talk about rabbits. My goodness.
Oh, we want to talk about the multipliers, right? So, yeah, so in addition to that, you're going to be helping less animals end up in the shelter, those medical behavior benefits. It's all very worth it. And I know there are some misconceptions, maybe that my pet's going to get fat or that it's really expensive. So are those true, Dr. Barber?
There is an increased incidence of obesity in animals that are spayed or neutered. Seems to be more prevalent with females. However, I've seen plenty of intact males and female dogs that are obese. So remember, it can be managed. It's a manageable condition.
Well, and it's also, it's health. I mean, it's diet and it's exercise. So just like humans, right?
It's nothing brand new. It's not rocket science. It's caloric intake. It's ins and outs. It's a sedentary lifestyle. It's exercise. It's a healthy diet. So
if you and your pet are watching Netflix too much, they might put on some pounds just like you. So right, that's right. Just like this happened to me. So yeah, so it's just being a healthy lifestyle for your pet. Yep. And we offer, there's lots of places in the community to get low-cost spay and neuter.
Absolutely.
We're not doing it right now for community spays, right?
Our community spay and neuter service is not open and running yet, soon, on its way. But just remember, San Diego area has wonderful veterinary partners. There's so many good veterinary clinics and hospitals and talented clinicians in this area that I would encourage anyone to follow up or to contact their family veterinarian's office for resources.
And I think we have some on our website as well. So yes, there's no reason not to get your pet spayed and neutered. Nope. It's Awareness Month. You can call, talk to our resource center if you have questions. But it's one of the greatest things you can do for your pet. And again, if you adopt, you don't even have to think about it. It's already been taken care of. So another reason to adopt as well. So, well, thank you, Dr. Barber. I'm going to let you get back to being a chew toy for this cute puppy.
I do understand that Spay and Neuter Awareness Month, but I always, as a shelter vet, want to also put in another plug for vaccination. So always keep your pet up to date on vaccines, please.
Excellent. And, well, while you are switching microphones, I thank you for that. We actually are doing our vaccination and microchip clinics still. So you can go online at sdhumane.org and make an appointment to get vaccinations or microchipping for your pet at any of our 4 campuses, El Cajon, Oceanside, Escondido, or here at San Diego. Tuesday through Sunday, we're doing vaccinations and microchipping. So please still do that because we want to keep your pet healthy as well. And Michelle, I brought this really cool because I love to show it. Look at this, Miss Lauren. This is what a microchip looks like. So microchipping is a permanent form of ID. This little grain is about the size of a grain of rice. We put that right between the pet's shoulder blades. It stays there forever. So if a collar gets off, no tags. If your pet makes it into the shelter, this is going to be much more likely to find their way home than if they don't have this. We do it for $25 and it's easy peasy. We get animals in the shelter. We scan them for that microchip like you scan the groceries at the grocery store. If they have this, we can know how to call you. And if you do have a microchip, make sure you keep your information up to date. If you move or change your phone number, you always need to remember to change it on the microchip too. Yeah. Okay, back to Miss Michelle and seeing some cool stuff going on.
Do it.
Oh my gosh, we keep our vet techs in cages.
Oh yeah, this is Christopher. He's a good boy. Yes. He doesn't bite, just sometimes. Just kidding. Christopher's actually taking care of one of our diabetic dogs that's here today. So here in the vet hospital, right in the front face of the hospital, we keep all of our patients that need just extra care. So Serenity here gets BG checks every 3 hours. So that's why we have her here. All eyes on her all the time. And Christopher's going to do that all by himself because Serenity is such a good dog. And we see a lot of really, really good dogs here, guys. I mean, they are just I think they're so grateful that they just never act up, honestly. They are the best patients. I worked in regular clinics, and no, they're not the best patients.
They're a little more spoiled when they come in with their owners.
They're very spoiled, but the ones here, they're so grateful. They're the best dogs.
And I'm going to say that's also a testament to our great staff, because you guys work really well with them. So,
in addition to Spay Neuter Awareness Month, it is also Dental Awareness Month. February is Dental Month. So we're actually doing, sorry, it's kind of loud in here. We're doing a very, very cool procedure today. And like I said before, this is not something that we do all the time. Kyle, our RVT here, turn around, you're on camera, is doing a dental on this pit bull, and Dr. Radke as well. She removed the canine tooth. Do you have it, Kyle? Oh, let me grab it. I want to show you guys that. There's 2 of them. Dr. Radke removed these teeth. Check this out.
oh my gosh, they're so big.
They are giant.
So again, there's a lot of root that we don't see.
So the only part that you see that actually comes out of the mouth that you're actually visibly seeing is probably like even less than half of that. Everything else is in there, and you have to really get in there and take it out. And as you can see, 80% of the teeth were under the gums. And you can see here all of the x-rays that we take every day. That's a good one. So that's the root of that big canine. Kyle here takes these x-rays for Dr. Radke. These are the front teeth. So this is just what you're seeing in the outside, and this is all the way inside the mouth. So
and
obviously it is
pit bull
very
is
difficult.
clearly under anesthesia, and a couple of reasons why is dental health so important, because if there's an infection in the mouth, what can that lead to?
Oh my gosh, that can lead to so many issues. Heart disease,
Heart
kidney disease. Lots of diseases in animals can come about. So February is dental month. Sorry, it gets really loud in here, so we'll get out. And it's a good time to lift your dog's mouth and just check it out in there. You know what I mean? Like a lot of people say, oh, my dog's breath doesn't stink, or oh, my dog's young. Dogs can start getting calculus in their teeth as soon as like 2 years old, 1 year old, and they need to get dentals monthly after that.
And my mom's dog is a Shih Tzu, so she kind of has one of those squish faces.
Yeah.
So if you have a squish face, like
Chihuahua,
a pug,
small
Himalayan cat, yes. If you have one of those, then it's even more important because they're so close together.
They need a dental.
So they're going to get dentals more often. So that's part of a healthy routine.
Absolutely. So let's keep going over here so we can take a look more. Okay, look at our little friend.
Oh my goodness, Lauren, get in there.
She's ridiculous.
Oh my goodness, why are you here?
This is the same one that Dr. Barbara was holding.
Oh my gosh, it's the same
one. I'm
one.
just so tired.
He says that was really exhausting getting my
so
cast
exhausting
on.
being that cute. We are actually doing a very, very, very cool procedure in here right now. We're doing a FHO, which is a femoral head ostectomy.
Oh.
So this dog, her name is Sophie. She was hit by a car, and her owners could not afford to do the surgery. So they really loved her, and they said, we really want to do everything for Sophie, but unfortunately we can't afford such an expensive surgery. We went ahead and opted to do it here, and we're going to charge them whatever we would pay. Very, very low cost. But they're really good owners, and they promise to, take care of Sophie afterwards.
We want to keep pets with families if that's an option.
Absolutely.
She comes from a loving home, but this is now, Michelle, the 2 patients we've seen have been hit by cars.
Yes.
So just that to me says,
also, Sophie wasn't spayed, so that's why she was out.
Oh my goodness.
She's looking for a Valentine's, and unfortunately didn't get to it. So then, she got hit by a car.
That urge is strong, people. So that is a lot of the animals who are hit by cars. Is a lot of times they're out roaming. They're more likely to get in fights because they're going to be competing for mates. So it is.
Not
it's
just
all
that.
like
They go under fences. They get lacerations. They get in fights with other dogs, coyotes, all sorts of stuff can happen.
And they will do anything to get out. I mean, that's not, so if there's a female and heat in the area, so we just really, really want to make sure that spay neuter is happening. I don't know what they're
out here.
Are they stuck in there?
I got you.
We wanted to let one of them out. There we go.
Yeah, so actually this kind of procedures don't happen in every shelter. We are really lucky here because we have a orthopedic surgery suite, and we have the tools, and the tools that they use, they use literally Home Depot drills that they were doing. And that,
I don't think we could show a live might be too
that's
much
crazy.
For me.
But
Dental was good.
This is like amazing that we can do this. This does not happen in any other shelter. And Dr. Clem is actually showing one of our doctors here how to do an FHO. So like I said before, we are a teaching hospital. Everybody kind of gets taught what to do next with a mentor. And we're able to do that.
Which is awesome.
Which is amazing.
And then I've seen, when I visit for tours and things, there's lots of, the interns then get to do the procedures under the guidance of a veterinarian.
Yes.
So they're learning. So then they can be the next generation
Exactly.
of vets in shelters.
Yeah.
And like I said, it's so important as a vet in shelters, you're looking at the whole population and keeping everybody healthy as opposed to just one patient and they're going back home. So it's such a different.
And not only do we even teach like future doctors, we also do RVT and VA internships too. So the difference between a veterinary assistant and an RVT per se, a veterinary assistant will do all of the packs, all of the cleaning, the shaving.
Ooh, do you want to look at all the packs?
Giving the meds?
That, just so we can
totally. Let's do it.
So they're doing the prepping and stuff?
2 veterinary assistants, and without them, we would not be able to start surgery or initiate anything. So you see Deborah here is actually wrapping a pack right now, and you use a sterile technique, and you get it into the autoclave. There you go. So she makes sure that everything that the doctor needs is in there.
And is it in a specific order?
It's in a
so
specific
they all know,
order.
So everyone is the same?
Everything is the same, correct, yeah. And then she wraps it. It's a double wrap. And there's obviously like a very, very fine way that you do this as well. You want to make sure that you do the double folding, so that way when the doctor does pull it, it doesn't pull on the other side or touch the other side.
Or fall on the ground.
Sterile procedures, right?
And this is where we sterilize them, right?
Yeah, these are literally, what are those like, what are the things that we use right now in our homes of pressure cookers?
Oh.
These are like pressure cookers, but to sterilize things. They sterilize with water, and they get really, really high in pressure and really hot. Ooh. So after running this, you have to dry them, and then they're ready to go and be opened and be used. Very cool. Yeah, we are very huge here, so we have obviously a lot of things that go on here. These machines basically vibrate everything out of the little crooks and the crevices of all of these everything has like little grooves. So you want to make sure that all the blood and everything's getting away from there. So by putting them in here for like 10 to 15 minutes, that is able to happen. Yeah.
This is fun. In our x-ray room, we've got it all.
X-ray room. So the x-ray room, it's very similar to human x-rays. It's got like kind of the same idea, except you don't tell an animal to stay still, right? You can't say, hold on right there, I'm going to go step behind and take an x-ray. You actually have to physically be in here holding the pet, or if they're sedated, it's the best thing to do, or under anesthesia. But most of the time we do sedate them, and we are in here. We have to wear radiology gloves and all that stuff.
I find these so interesting too. These are weight bags, right? So that's to keep them still during so these are heavy to keep them, but to keep their legs still.
So what you can do is you can put one of their arms through this and then kind of put it out so that way they can hold it out. With birds, you can use tape to kind of hold their arms straight, or their wings straight, I should say. And after we take the x-rays, everything is digital here. We have a really, really awesome dental x-ray machine. This is a neck of what it looks like a cat. That's a long neck. Yeah. And then this is the whole body. So everything in here is just super high tech, and we're so lucky to have this amazing, amazing x-ray machine. I mean, when I went to school, I had to literally dip it into like the...
Oh my goodness.
Yeah. I mean, this
like a photo.
Yes. In a dark room. Like, I'm not
there
joking.
You go. Yeah. That's amazing.
And like what we do now, I mean, we can like zoom in, we can make it darker, we can make it bigger, we can crop it, we can look really closely. So this is the heart right here, and the chest. You can see all the bronchial patterns here. And this is the bladder. These are all the intestines. This is a kidney right here. So you're able to see everything with these x-rays. I mean, they're so detailed. And this also counts like our exposure a lot less, because we're only having to take one x-ray versus, I can't see that way very well, or I can't see this. Can you get closer here? We're able to take one shot of the whole body, and the doctor is able to, zoom in and look at whatever they want. So
it is pretty amazing, which allows us to do all the amazing work that we do, which is pretty incredible. Do we have to send labs out for lab work, or can we do that here too?
So we actually recently just received really, really cool lab machines here, but we do send things out. And that's a great point because I've worked in a lot of shelters before and we've never had these machines. They only exist in like emergency hospitals. So we're actually able to run lab work here inside, and we're able to run everything that we need and get immediate results like right away. All of this stuff was very, very expensive. And we're so lucky to be able to have this. We really only run it for those patients that we absolutely need blood for and results for right away, or else we just send it out to the lab and receive it the next day. But we are lucky enough to be able to have this in case of an emergency, in case of our little friend here who's diabetic, and we need to see like what's going on.
Okay, look at this little one drinking.
Serenity.
So cute.
Yeah, she's a really good girl. Yes, you are.
And we've done some really, what I love are our stories of just our creativity with our vets and some of the cases we've had. We get, a turtle who had mended his shell with a screen door patch, so you get really creative here. And like we said, you might be neutering a pig in the morning. You might be doing a procedure on a rat in the afternoon. There's so many different, like every animal that comes here. And what I think too is, as opposed to a regular vet, our vets here have to be kind of detectives. They don't have the history of the animals.
We know nothing.
They don't have anything. Oh, do we have a question?
I would like to know how you sanitize instruments and common things like ringworm and
Ooh,
good. Yeah.
That's a
So
great
we
question.
have what is called Rescue, which is a really amazing disinfectant. This actually belongs in radiology. And this stuff is a virucidal, bactericidal, fungicidal, and a sanitizer. So it literally kills anything and everything. I mean, you can like spray this on yourself and you're like good to go. So you have to leave this on for 5 to 10 minutes. For ringworm, it's obviously spread in the air. So you want to make sure that you clean even the walls, the vents, the everything. But 5 to 10 minutes, I mean, everything will be gone, even COVID. I'm just saying. So this stuff is the way to go. And I know there's a ton of other kind of disinfectants that they use. The 222 is another one that they use in shelters, but this is the best one on the market right now. And luckily we have connections with them, and they are able to we have this coming out of hoses. Like, I'm not surprised if you like do this and it comes out.
And you also, I mean, I've seen it when we have animals out there, the quarantining and the gowning and the gloves, like everything is so orchestrated. I mean, so if there's an animal who might have it,
every single animal, you have to change the gloves, and we have all of our gloves like readily available in every single corner for you to just be able to intermittently change.
And then if they do have ringworm, they're in a separate once yes. Those are good questions though, because I can imagine that, and that's why shelter medicine has become its own area, is because you have to, like, that's the thing, you have to look at the whole population and the spread of disease and all of that, and keeping the health of the population in mind.
We do actually have an area of isolation. I won't walk you guys there right now because we have 9 distemper dogs, and it's very highly contagious, and we have a puppy on the floor. So we like to remain, like, if you're going to be working in distemper, you are not to be working with any other puppies for the rest of the day. If you're the doctor in isolation for the rest of the day, you can't see foster appointments that might have puppies coming through. So we're really good about, keeping the same people in the same areas. If you're in surgery, you're not going to be mingling around in distemper wards.
Yes, and that would because that would be the worst if we are the cause of the spread of the disease.
Exactly.
Okay, you have to go look at the cute Pipple who now doesn't have a giant tube in his mouth, because I want everybody to see how cute he is. And I also noticed, so you said that Kyle was an RVT.
Yeah, Kyle's an RVT.
It looks like Kyle was doing lots of work. So what can RVTs do? Yes, thank you, Kyle. So what can RVTs do?
All of the extractions.
And what is the veterinarian doing different?
Yeah, so here our DVM does all of the extractions, but the RVTs legally, they can do the extractions. The assistants cannot. Kyle did an extraction today.
Kyle!
Yeah.
Oh, wow. That's awesome.
Some gingival sutures.
Yeah, so the RVTs can suture. They can suture anything from the mouth to small, cuts or lacerations.
So I think he said gingival suture. So will you explain what that is?
Yeah, so you can zoom in and take a look.
Oh,
and that's a beautiful, beautiful.
Well done. Dog. So the RVTs also, they can do they do things that and
substances. So the RVTs have licenses to handle class drugs, just like buprenorphine and hydromorphone, fentanyl, versus our VAs do not. Our doctors also don't really handle those drugs. They can, but
We love
they're a
that.
little less responsible than the RVT.
So an RVT I compared to like a human nurse.
Exactly, yeah.
Yes.
A registered nurse versus a nurse assistant.
And then the
kind of a thing.
veterinarian is like the doctor. So
Correct,
think of when you go to the hospital. I know Dr. Bragen's here, but when you go to the hospital, who do you see the most? Who's doing all the work? The nurse. And then the doctors come in and make diagnosis and plans, and they're very important. We love you. But but yeah, so the RVTs get to do
And
a
this
lot
little
of the heavy
friend's gonna
lifting
wake up
too.
right here. He's under all of his wormies, so he even has socks on. Stop! It's so cute. Stop!
Oh my goodness. Okay.
And I always say, if you guys have socks that you're gonna, your kid's too big now, growing out of these socks, donate them.
Donate them to the shelter, and look at a
Yeah.
cute pit bull might wear them for
Yeah.
surgery.
Keeping
Oh
the
my
little
goodness.
limbs.
Look at, okay, the little bunny socks. Okay, please,
They're
please
cute.
donations, everybody.
I mean, look at this. This is ridiculous. I mean, you
That
can walk
is
in
pretty
these
cute.
afterwards.
We have, what is this dog's name, please, so we can?
Smokey.
Smokey. And is Smokey available for adoption? Do we know?
Yeah, he will be.
He will be, all right.
So we like to keep them here after their dental, just to
if
make sure that
Smokey's
they're
been smitten
eating.
by Smokey in his mouth, he will be here.
Yeah.
Thank you, Kyle, and thank you, Dr. Becker. We appreciate you letting us barge in. That's some pretty cool stuff we do here. It's pretty amazing.
Oh yeah.
Okay, do we want to do the grand finale? Are
Let's
there any other
do
questions?
it.
Because there's some really, so we showed you what happens on the outside of surgery, but oh my goodness, there's some really fun
have
finds on the inside as
This
well.
is really cool. Sorry, Edgar. This is what I like to call my little box of wondrous things. And Dr. Barbara and I like to save these things to show you guys whenever we do anything like this, because people are always amazed at what we pull out of animals, right? This is a bladder stone, and I am touching it without gloves on. Judge me.
Don't judge.
This is a bladder stone. So this was in a dog's bladder.
And I think it was only like 40 pounds, right? It wasn't
It was
a very
not
big
a giant dog. Correct. Yeah. So the dog came in to see us because the owners could no longer afford vet care, and the dog was trying to urinate and couldn't, because could you imagine trying to pee?
No,
over
and
this?
I don't think people understand.
like.
And I don't think people realize how heavy that it's like a rock.
I mean, it's a rock.
It's like a
It's a
stone.
legit rock.
It is
So
heavy.
these are all made out of different things. We send them in to be
So you imagine,
examined.
I just think of like the poor
This is
little
another
bladder, like getting hit by that. And so this is also what I'd like to remind people. If all of a sudden your cat or your dog is having potty issues, maybe they are house trained and they're all of a sudden not being house trained, or they're peeing outside the litter box. Sometimes it could be a medical issue. Please don't always get mad. It might not be behavior. So you always want to check with your vet as well.
Eyeballs. We like to take
Ooh.
out eyeballs here.
When needed.
When needed, not just for funsies. So a lot of the times dogs will come in because they got in a scuffle with a resident dog and then the eyeball just popped out. Or they're a pug and their eyeballs are normally like that, and then anything kind of ticked them
Get
off and made it.
scratched or
Exactly. And sometimes, we just can't fix them. We try to as much as we can to keep them in. But if it's causing any sort of pain to that animal, we will go ahead
shall
and
we
remove
have
it.
a movement in action? So here's
Here's another eyeball.
okay.
Eyeballs
look at our
are a
little
thing.
puppy. So
There's
he'll go
our
to
doctor.
recovery room.
Yeah.
Oh my gosh. More
Smokey.
eyeballs.
Yes,
Smokey.
more eyeballs.
I love
More
Smokey.
teeth. So this is a smaller dog.
And again, I'm sorry
Canine.
if I missed this at the beginning because there's so much going on. Is this all in one animal?
Yes. Yeah.
Oh my
So
gosh.
bladder stones can come in different shapes and
I
sizes.
guess so,
You
because
can
these are very
have-
smooth.
Yeah, you can have
And
really
this one.
beautiful rocks like
This is
this. You
beautiful.
can have very ugly rocks like this.
And then imagine that hitting your bladder. You got all the little
So these
edges.
bladders are normally so irritated. I mean, they're red. They are angry. You have to flush them. They have to
Aw,
remain in
poor
urinary
things.
catheters for a while. Sometimes they can make them again. So you have to change their food, give them different medications every day, so that way they don't crystallize or do anything like that again.
Because yeah, some
A
animals
brain.
get more prone to it. Oh, a brain.
This was my favorite one, I have to say.
You like the brain.
This is a kitten.
Oh.
Yeah. Unfortunately, this kitten was already deceased. And the owners had said that it was acting really neurologic and it just wasn't right. And they had brought in the body for us, and we decided to do a necropsy at that point and
Oh.
kind of take a look and use it as a learning experience, because that's what we do here. So yeah, unfortunately this kitten was already passed. So we, took that opportunity to make it a learning opportunity. Let's see, what else do we got here?
Oh, that looks like
Another
brain.
brain. Yeah. I don't know what this one came out of, to be quite honest, but
This
a
is
lot
yes,
of the
Dr.
times-
Barber's collection who had
Yes,
joined us
exactly.
earlier. Because it is. It's fascinating. Then you can use these
These
to
are
teach
toes.
interns.
These are really gross.
Okay, I don't know.
I don't like toes.
That's
These are
disturbing.
toes that came out of, I don't even know, a lizard or an iguana or something
Oh.
like that. And sometimes you have to amputate toes
That
because
looks
they
like
have,
iguana toes to me.
they have tumors on them, or they have
Oh.
something on them that we can't fix, and they need to go right away. So yeah, they
we
still
don't want
have
it to spread,
nails.
just like yes.
Ugh. I don't like toes. I'll do
I
eyeball
love how you,
brains.
nothing else
But
disturbs you but the toes that you
Ew.
see normally. But it's the inside parts you like. Okay,
Toes are pretty gross, not gonna lie.
there we go. Do we
Any
have
other
any other questions, Miss Lauren?
We didn't have questions, but we did have someone say they had a really good experience getting their dog neutered through Oscomate, so thank you.
Oh, that is awesome.
Yeah, I'm really excited to be able to open up our CSN appointments again, which are community spay neuter. We do very low cost spay neuter clinics for all of the people in our jurisdiction. And I think it's like $60 for a cat neuter. And
yes.
it's super,
And it is a
super
quick
inexpensive.
person. You drop them off in the morning. You can pick them up in the afternoon.
3 days of pain meds and good
Yeah,
to go.
so it's so even if it's not through us, which we can't do right now, so I want to stress that we do not have community spay neuter appointments available right now. Please keep checking our website. We are hoping to get those back as we can do
Soon.
them safely because we
Yes.
want to keep our staff healthy to care for our animals here. But we are doing the community vaccinations and the community microchipping. So you can go online at sdhumane.org and make an appointment at any of our campuses.
Yeah, we actually have a really big one coming up on the 17th at El Cajon.
Oh, nice.
And there's a lot of open appointments. So if you guys, need that, that is an essential service. So we are still, allowing that to happen even through COVID. And it's really
Yes.
important for all of our pets to be vaccinated. It's very, I
Yes,
can't
think
stress
of
that
community health. Exactly. So when they
Exactly.
come in, and again, spaying and neutering, please, please, please consider it if your pet is not already spayed or neutered. If you want to, if you need a family member, just adopt, and they will already be spayed and neutered. They will already have a microchip. They will already have their vaccinations.
Everything.
You will get a free bag of food.
You
get
don't
a
even
free
give you a stone.
We,
Like, just kidding.
You'll get a free vet. You get one stone. Free vet exam with your vet. You get a behavior consult on an hour hotline with one of our trainers. Adoption is the best option.
Oh,
is
yeah.
it not?
Totally.
So yeah, so
I can't stress that enough.
that's right. And dental health. Don't forget your pet's teeth first because you
Yeah.
want to make sure that those aren't going to lead to something else. So
Take a look
always-
at your pet's mouth today.
that's right. And if all these things sound great, but you say, hey, I can't afford all those things for my pet, please, again, go to sdhumane.org. We have veterinary assistants. There are organizations and nonprofits who help with that because we want your pet to be healthy. And we don't want them to be in any pain. So please, we can help. And we have our community pet pantry every day, Tuesday through Sunday, 9 a.m. to 6 p.m. If you need some dog or cat food, just drive up. We'll put it in your trunk and on your way. So
yeah, even for a spay neuter, I know we're closed right now, but if people are, big need or anything like that, we can help. We can always help. We are
email Michelle.
Yeah.
They're going to be calling the
I know,
resource
right?
center.
I know, all day long. Yeah, we're not doing it right now for normal people, but if there is assistance that is needed, you can always email. And once we are open, we can kind of,
Absolutely.
take those day by
And
day.
you can apply for vet assistance at your own vet. So yes, we have, we will help.
Resources.
We have resources. That's the right word. So, and
Absolutely.
we want your pet to be healthy
And stay with you.
and stay with you. Exactly. We don't want them to end up here in the shelter. So thank you so much for joining us today. Thank you,
Thank
Michelle,
you.
for taking us on a cool tour of this facility.
Of
We are
course.
really very, very lucky to be able to have this and to help all the pets that we can in San Diego. And if you're looking to adopt, please visit sdhumane.org and look at our available pets and bring one home. Maybe Smokey,
Maybe
right?
2.
Yeah, or maybe 2. Yes.
Two or
And
3.
that cute Smokey who'll be ready to recover with some soft food and
Yeah.
some snuggles.
And
So-
Smokey won't need a dental for another year.
Exactly. We've already done the dental for Smokey. You saw it.
Mhm.
So thank you so much, everybody. And next week we will have our virtual adoption event and Paint with Lovejoy on Wednesday. So join us next week, Wednesday and Friday at 3. Thanks so much.
Bye.
Bye-bye.